Hi, I'm Jamie Spitale. I am doing a video recording of a full physical assessment. I have my patient right here and she will be walking right on in. All right, as she walks in, I notice that her gait was steady. She's well groomed. She is dressed appropriately for the weather outside. I'm going to introduce myself, offer her to empty her bladder, and ask her to put on my gown as well. Hi, I am going to be a nurse today. I am James Spitale. If you need to empty your bladder, please feel free to now. Okay, she has emptied her bladder. And she has donned a gown. Ma'am, can you have a seat up on our exam table, please?
Okay.
I am going to start out with an inspection of her head, and it's noted that that sits upright on her neck. It's round in shape. Nothing abnormal at all whatsoever. I'm going to get her vital signs too as well. So her vital signs are done. Height and weight, everything's complete. All her vitals are within normal limits. So she has a normal cephalic. Her head is upright on the neck. She has normal color scan. There is no discoloration, no lesions. Her eyebrows all look well manicured in place. So on her eyelids, there is no ptosis, no swelling. There are also no lesions on there as well. She has eyelashes that are all intact and appear to be equal bilaterally. And I'll give your glasses back to you here in a second, ma'am. Now I'm going, and then I also note too that her inner canthus is completely parallel with the auricle of her left ear. That is a normal finding. And it is bilaterally. Now I'm going to inspect her scalp. Her scalp appears to be normal from what I can see of it. Nothing. No dandruff, no anything like that. Now I am going to palpate her scalp. Is there any tenderness or pain while I palpate your scalp?
No.
All right. So her scalp. So it moves as it should. There's no pain and there is no tenderness noted. Next, I am going to assess her face and all of her facial bones. So if you feel any pain or tenderness anywhere around here, if you'd let me know. I am assessing so her frontal sinuses. Is there any pain or tenderness? Now her maxillary sinus is right through here. And is there any pain or tenderness right there?
No.
I am going to also palpate her lacrimal apparatus. And is there any pain or tenderness there where I was touching? Fantastic. If you can smile for me, if you can puff out your cheeks. And so she has an even smile. Her cheeks puff out evenly bilaterally. So her seventh cranial nerve is intact. Now I'm going to assess so her TMJ. Now, ma'am, whenever I tell you to, go up and down. No. Sorry, ma'am. With your jaw, up and down, only with the jaw. Okay, up and down. Okay. And now if you move side to side. No. Just your jaw only.
Oh.
No. Okay. Also, thank you. So her TMJ is intact. There's no popping, no crepitus, no swelling noted at the time. Now I'm going to do a light touch on her face. If you'll close your eyes for me, and just tell me if you can feel me touch you.
Yep. Yes.
I would normally use a cotton ball, but I don't have one in the house.
Yes. 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 Yes.
All right, fantastic. So her fifth cranial nerve is intact. That's all good. Now I'm going to inspect her eyes. I can look at her eyes. Her pupils, they appear to be normal. Eyes have They have good formation. Again, her eyebrows, her eyelashes are all within normal limits, no swelling, no ptosis noted, as I stated earlier. Now I'm going to inspect her conjunctiva. Open your eyes for me, ma'am. I'm just going to pull down here a little bit. All right, so it's pink, pink and moist, which is good. Her sclera on her eyes are white. There is no yellowing, which would be a sign of jaundice, which would be a further concern. Now I'm going to shine my pin light into her eyes, and I'm going to assess Perla. So if look at my nose for me. So her pupils are equal reactive to light bilaterally. Now, if you will, with your eyes only, if you'll follow my finger. So her second, third, fourth, and sixth cranial nerve are intact. If you can tell me when you stop, so look at my nose, and if you'll tell me when you stop seeing my fingers.
Okay.
All right, so she has great peripheral vision. Now I'm going to inspect her ears. So on her left ear, it appears to be normal with a piercing. On her right ear, it also appears to be normal with the piercing, no swelling. Is there any tenderness or anything like that? Okay, fantastic. So inspection and palpation of her ears are normal. I'm going to look into her ears, even though I don't have an otoscope. Just gonna pretend to. All right. All right, everything appears to be intact. I see pearly, gray, smooth, so membranes. Now I'm going to inspect her nose. Her nose appears to be straight, normal, 2 nares. She has a piercing on her right nare. Now I'm going to look on the inside of her nose. If you look up for me, ma'am. So on the inside of her nose, it's pink and moist, no excessive hair growth, no lesions, no bleeding, anything like that. So how's your smell? So are you able to smell okay?
Yeah.
What does it smell like?
Strong berry.
Do what?
Strong berry.
A strawberry?
Uh-huh.
Okay, perfect. So her cranial nerve 1 is intact. She is able to smell. That's her olfactory nerve. Now I'm going to inspect her mouth. Ma'am, if so, you could open up for me. I'm going to shine a light in there. Tonsils are intact. No lesions. Ma'am, hold your tongue out for me. Can you move to the left? Can you move to the right? All right, no lesions noted on her tongue at all at this time. Ma'am, if you can open up and say look up for me. Okay. All right. So she has a uvular rise with her gag reflex is intact. Now I'm going to inspect her neck. No lesions, no discoloration noticed. It appears to be straight. Trachea is on there and it's midline. Now I am going to test the strength of her neck. So ma'am, if you'll push against my hand over here. Okay, perfect. With your neck only, okay? Now if you'll come forward and now go back, fantastic. If you will lift up your shoulders here for me, okay? Perfect. So her 11th cranial nerve is intact. She has good strength with her neck and her shoulders. Now I'm going to palpate her carotid arteries. I'm going to do one at a time, so I don't want to cut off circulation. Good, strong 2+ carotid artery. I'm going to palpate her trach. It appears to be normal. She's a little ticklish. Now I am going to palpate her thyroid. Ma'am, if you turn your head to the left and look down, yeah. For me, there we go. Swallow. Fantastic. All right. If you hold your head up for me there. So I did not, there were no palpable masses on her thyroid, and it also did not appear to be enlarged. Now I'm going to palpate her lymph nodes, her cervical lymph nodes. If you feel any tenderness where I'm touching, ma'am, if you please let me look up for me. If you would please let me know. Any pain where I'm touching?
No.
Oh, okay, so all her cervical, so all of her lymph nodes are all within normal limits, no swelling, no anything like that at all. I'm going to listen to her carotids using the bell of my stethoscope. No bruit heard on the left. No bruit heard on the right. Now I'm going to examine her upper extremities here. She will have to take the gown off, but I will keep her breast covered, so for her privacy. Her muscles, just relax. So she has equal muscle tone on both sides. Skin looks great, no lesions. She has a beautiful wedding ring on her left hand. She has a few scattered freckles, no lesions, sores, or blisters noted anywhere. I'm going to assess her brachial pulse. 2+ on the right, 2+ on the left. Now her radial pulses are equal bilaterally, 2+. Now I'm going to do a deep tendon reflex. All right. All right, she has great deep tendon reflexes bilaterally. Now I'm gonna have you hold out both your palms for me, up like this, and I'm going to test her for graphesthesia. So if you can close your eyes, and if you can tell me what letter I am drawing on your hand right now.
S.
All right.
S. Where's that 8? K.
There we go. Perfect. Now you can open up your hands or your eyes. Now I'm going to also test her for sterigenosis as well right now. What I'm going to do is I am going to have you close your eyes. I'm going to place something in this hand right here, and I want you to identify it without looking at it, okay? So go ahead and close your eyes. And close your hands. All right, what is that?
Keys.
All right. Okay, open your hands.
Keys.
All right. You can close your
pen.
hands. Okay.
Tape.
Okay.
Pen. Tape.
Fantastic. She passed that with ease. All right. Now, if you can grip my fingers equally and squeeze. Okay, fantastic. She has equal muscle strength bilaterally. Ma'am, if you'll stand up and if you will face the back there, I'm going to inspect your back now. So as I kind of feel on your back, so whenever you feel pain, let me know. No, any pain?
No.
Okay. So she will have a gown on, and this will be open usually in an actual, with an actual patient room here. Now I am going to palpate down your spine. Whenever you feel any pain, just stop me. Any pain anywhere?
No.
Great. All right, bend over for me a little bit. Just gonna test you. All right, fantastic. If you can come up now. So there is no pain or tenderness on her spine or in her back. No signs of scoliosis. No signs of kyphosis. Now I'm going to assess for any CVA tenderness. Can you tell me if this hurts?
No. No.
Okay, good. No CVA tenderness. Now I'm going to percuss her back, and I'm going to listen for good resonance. All right, great resonance heard all throughout. Now I'm gonna auscultate her breath sounds. So you don't have to breathe in and out because I don't want to hyperventilate. I'm gonna start in the upper lobes. Deep breath in, deep breath out. Clear, clear, clear. Now I'm gonna listen laterally as well. Her breath sounds are clear to auscultation in all lung fields. All right, ma'am, if you will get up on our exam table, and if you lay down for me. Would you like your glasses back, ma'am?
Sure.
Okay. Now I'm going to assess her anterior chest. She has, I will have her exposed with her breast covered, so as much as I can for the exam. So as she breathes, I can see that she has equal rise of the chest and fall. So I am going to palpate her chest, so I would start at the nipple, and then I would work around on both sides. I would feel for any lumps, any crepitus, anything that would be out of the ordinary. I did not find anything on my examination. Now I'm going to percuss her chest. Start at the mid-clavicular line and going all the way down. All right, good resonance heard throughout. Now I'm going to assess her heart sounds in all 5 of the areas there. Whatever the aortic, the pulmatic, the pulmononic area, Erb's point, the tricuspid, and then the mitral valve. S1, S2 heard throughout. No murmur heard, no extra beats, no abnormal heart sounds. Now I am going to do an assessment on her abdomen. I am going to first inspect, and I will keep her covered for her privacy. So her stomach appears to be the normal limits. No scarring. She does have some tattoos on and around her stomach. No scarring, no abnormal hair, no lesions, no anything like that. Now I'm going to auscultate her abdomen. I'm going to be listening, starting in her left upper quadrant and then working clockwise. All right, all bowel sounds, they are all normal active in all 4 quadrants. Now I am going to also listen while I have her abdomen exposed. I'm going to listen for any of her arterial sounds here. So I'm going to assess her aorta, her renal arteries, iliac, and then her femoral, and I will be listening for bruits, and I will use the bell of my stethoscope. And I also note too that I do not feel any aortic pulses as well. All right, no bruise heard. Now I will percuss her abdomen. It's a hollow organ, so I would expect to hear some tympany. In palpation of her abdomen, it appeared, percussion of her abdomen appears to be within normal limits. Now I will percuss the size of her liver. I will start at the midclavicular line, and then I will percuss all the way down from resonance to dullness, and then I'll start down here from tympany up to dullness as well. And I will mark, and then I will measure the size of her liver. and I will make a mark here. And I'm starting at the bottom, come up. Your dullness there, make a mark there, measure it. It is so at 7 centimeters. She has a normal size liver, which is between 6 and 12 centimeters in size. Now I am going to percuss her spleen for the dullness of her spleen. Dullness noted. Now I would do a light palpation of her abdomen. All right, there is no pain or tenderness. She appears to be a little ticklish. Now I will do, so her abdomen is soft, her muscles are firm. It's within normal limits. Now I will do a deep palpation of her abdomen, okay? If you feel any pain, let me know.
Oh.
All right, upon the, in the deep palpation of her abdomen, there were no abnormalities found, and she had denied having any pain at all whatsoever. Now I am going to palpate, so her liver border. If you could take a deep breath in, hold it. All right, she has a normal liver edge. I am going to palpate her spleen as well. No abnormalities found. I will attempt to palpate her kidneys. Unable to find her kidneys, which is a good sign. All right, man, if so you just sit up on the edge of the bed here. Now I'm going to assess her lower extremities. As I inspect, they appear to be normal. She has a little bit of, she has a small bruise on her right knee. Where did this come from?
Banged it on a coffee table.
Okay, all right. No hair. She appears to shave her legs. Actually, you know what? Let's get you to lay back down. I'm sorry, man. I am going to inspect her legs up here. No edema noted. No pain or tenderness where I'm touching. I'm going to palpate her femoral arteries. Good 2+ pulses on her femoral arteries. So tell me if this hurts. So just relax.
No.
All right. She has a negative Homan sign. All right. Now, if you'll sit up on the edge of the exam table for me. I am going to palpate your popliteal. Pulses down here. 2+. Now your tibial pulses bilaterally. 2+, and now your dorsal pedis pulses bilaterally are all 2+. If you will close your eyes for me, and if you tell me which way I'm moving your toes.
Up, down, down.
Fantastic. Intact. Now I'm going to test her reflexes. Her patellar reflexes are intact. Her popliteal reflexes are intact. She has great deep tendon reflexes on her lower extremities. Now I'm going to test her knee strength. If you will pick up your knee, okay, good. Again. All right. If you'll push this out right here, okay. And if we push out that way, push in, and push in. All right, fantastic. She has great knee strength. No abnormalities found there. Oh, and now is your ankle strength. If you will push up to the sky against me. All right, push on like a gas pedal. Push up, up towards you, and down like a gas pedal. Fantastic. Ankles equal in strength bilaterally. And when, all right, so if you can extend your knee for me. Perfect. Back down. And you can go, each side to side. Okay, great. She has complete range of motion in her knees. So move your ankles around for me. All right, up and down, and if you go side to side, fantastic. So her knees and ankles both have complete range of motion. I'm going to inspect her toenails. Her toenails are pink translucent, capillary refill less than 3 seconds, all the way through. They're all within normal limits. Now I am going to do some neuro checks on her. If you can grab my fingers again and squeeze, squeeze, squeeze. All right, I want you to pull towards you. Okay, I want you to push towards me. Fantastic. Okay, if you can hold your arms out like this, palms up, eyes closed. No arm drift noted. Able to hold arms up for over 5 seconds. All right, if you can put that down for me there. Now, if you will take your right heel and if you rub it knee down to your ankle for me. Okay, fantastic. And if you do the same on the other, fantastic. So she is able to do the heel to foot, the knee to foot with the heel test without any issues at all. Now I'm going to assess her sharp versus dull. All right, close your eyes for me, and whenever you feel something touch you, if you can tell me whether it's sharp or dull.
Dull. Sharp.
Okay.
Dull. Sharp. Sharp. Dull. Dull. Sharp. Sharp.
Okay, uncross your legs for me. All right, eyes closed.
Dull. Dull. Sharp. Sharp.
Fantastic. So her neuro is completely intact. Now I'm going to assess her musculoskeletal. I have already tested her deep tendon reflexes. Now I'm going to examine in the range of motion on her neck. If you can look down, look up, all the way back, side to side. Fantastic. Range of motion is intact. And if you can hold this arm out for me and bend it towards you. Okay, fantastic. If you were the same for that right there, up like that, okay, good. Now you come out like this, and if you rotate it in, then out, in, then out. Okay, great. She has excellent range of motion in her elbows. Now if you hold your wrist out for me, and go like that, and I'll go up, down, down. All right, she also has great range of motion in her wrist as well. Now I'm going to assess the range of motion in her shoulders as well. If you would cross his arm in front of you, like all the way in front of you, perfect. All right, now switch arms. Put that one down. Switch arms, fantastic. Now hold both hands behind you, fantastic. And now if you can raise them both over your head, fantastic. She has a complete range of motion in her shoulder as well. Just stand up for me, ma'am. Now I am going to assess how her range of motion is in her spine. So if you can bend backwards, any pain?
No.
Okay, great. Bend forward, touch your toes, as well as you can. Any pain?
No.
Okay, great. If you'll bend from side to side. Any pain with that?
No.
All right. This will conclude my physical assessment video. So thank you very much.